What would happen if we valued our patients' time as much as they value ours? Take a moment with that question because it's not rhetorical. It's the starting point for a profound shift in how we deliver care, structure operations, and engage with our communities. In a healthcare system increasingly shaped by convenience, accessibility, and consumer expectations, the simple act of respecting time, your patient's time, can become the differentiator that sets your practice apart. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Life Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 133, Flip the Script: Why Respecting Your Patient's Time is Your Practice's Secret Weapon. What would happen if we valued our patients' time as much as they value ours? Take a moment with that question because it's not rhetorical. It's the starting point for a profound shift in how we deliver care, structure operations, and engage with our communities. In a healthcare system increasingly shaped by convenience, accessibility, and consumer expectations, the simple act of respecting time, your patient's time, can become the differentiator that sets your practice apart. Today, we're diving deep into the operational habits that quietly waste our patients' time, the unspoken messages we send when we do so, and how you can create a culture that flips the traditional hierarchy, putting patient experience and efficiency front and center. This isn't about being fast and transactional. It's about being thoughtful, intentional, and human. Let's begin with a reality check. Across the country, countless patients show up early to medical offices, only to sit in waiting rooms well past their scheduled appointment times. Then they're ushered into an exam room where they wait again. Maybe someone takes their vitals. Then, more waiting. Eventually, they see a provider, sometimes for just 7 to 10 minutes. All this for what might be a 2 to 3 hour long time commitment, often carved out of work or family time. And here's what makes it worse. It's avoidable. There are operational decisions, some legacy, some unconscious, that perpetuate this cycle of inefficiency. Let's unpack a few. Take scheduling, for instance. Many practices still rely on outdated templates that were designed more around provider convenience than patient flow. Overbooking is common, justified by the likelihood of cancellations or no-shows. But when everyone shows up, chaos ensues. Delays build. Staff stress rises. And patients are made to wait. Another culprit: paperwork. Patients are often asked to fill out redundant forms each time they visit, even when nothing's changed. They've already given their medical history, their insurance details, their preferred pharmacy. And yet, here comes the clipboard, or the lengthy online detritus of forms. This doesn't build confidence. Rather, it has patients heaving a big sigh. A personal confession here: I have been known to strike through entire parts of the paper forms and write a note that says, "This is already in my chart." Then there's the issue of uncoordinated care. A patient sees their primary care provider, then gets referred to a specialist, then has labs ordered, maybe some imaging too. But no one seems to coordinate with each other. The patient becomes the courier of information, repeating their story at every step. It's not only inefficient, it's dehumanizing, and leaves the entire care episode open for errors of all kinds. Delays in communication are another time thief. Test results often trickle in without a clear system for prompt delivery or discussion. Patients may wait days, sometimes longer, wondering whether they need to call or if someone will reach out. Often, no news is assumed to be good news, which is a gamble we shouldn't be asking patients to take. Now, these operational inefficiencies aren't just logistical problems, they send messages, subtle but powerful ones. When we waste our patients' time, we tell them, "Your time is less valuable than ours." We tell them, "We haven't thought through your experience." And, perhaps most harmfully, we reinforce a paternalistic view that patients are recipients of care rather than participants in it. This would be problematic in any industry, but in one built on trust, vulnerability, and healing, it's indefensible. It's also short-sighted. Because here's the truth: the healthcare market is shifting. Commoditization is real. Patients, especially those with higher deductibles or access to alternatives like telemedicine, urgent care, and concierge services, are beginning to vote with their feet. They're asking, who respects my time? Who sees me as a whole person, not just a time slot? And they're making decisions accordingly. We see this in the rise of clinics that advertise wait times on digital billboards, in telehealth platforms that promise access within minutes, in membership models that prioritize seamless coordination and proactive communication. Convenience, transparency, and responsiveness aren't luxuries anymore. They're table stakes, minimum expectations. And for traditional medical groups, this can feel like a threat. But it's also an opportunity, because the tools and strategies that improve patient time respect can also reduce staff burnout, increase patient loyalty, and even improve clinical outcomes. So how do we begin to change? How do we not just keep up, but lead? It starts with workflow redesign. Many inefficiencies in practice operations are not caused by malice or indifference. They're simply inherited habits. But those habits can be changed. Start with digital engagement before the visit. Allow patients to complete forms online, update medical histories, upload insurance cards. Better yet, auto-populate those forms with what you already know and only prompt updates when necessary. Every minute saved on a clipboard is a minute gained in human connection. Leverage automated reminders and two-way texting platforms that allow real-time confirmations, rescheduling, and updates. Make check-in possible from a phone in the parking lot or via kiosk with minimal touchpoints. You need to be doing business by text at this point in the game. If you're not, it's time to start. Now let's talk about scheduling. Look at your templates. Are they built with patient flow in mind? Do they account for visit type, provider habits, and actual demand trends? Can you offer more predictable time slots or even flexible hours that reduce congestion at peak times? Consider tools that allow patients to see where they are in the queue, just like airplane apps show gate changes and boarding groups. Transparency builds trust. And what about during the visit itself? You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. Time motion studies can be eye-opening. Often, small adjustments, like pre-rooming certain tasks or batching administrative work outside of patient face time, can dramatically streamline the experience. Set clear goals for average visit time, but measure what matters: patient satisfaction, completion of agenda, efficiency of flow. When it comes to discharge, don't let the visit end in confusion. Give clear next steps. Use summary sheets. Offer electronic instructions. Coordinate follow-ups before the patient leaves. Waiting on the phone days later to schedule a consult shouldn't be the norm. It should be the exception. Of course, none of these operational improvements will stick without a parallel cultural shift. Efficiency alone isn't enough. Respect must be felt. That starts at the front desk. Are staff trained to greet each patient warmly, acknowledge delays honestly, and offer solutions? A simple, "Thank you for your patience, we're running about 10 minutes behind, but we'll keep you updated," goes a really long way. Offering choice when schedules are backed up also leaves the patient feeling respected. Can you invite them to go across the parking lot for a coffee and that your team will text them when you're ready for them? An offer like that goes a long way towards respecting their time. One office we worked with would let the patients know that the doctor was hung up with a patient emergency and would be with them as soon as they could take care of the patient in crisis. Then they offered them multiple options. Most patients were happy to wait, knowing that if they had an emergency at any time, they'd be prioritized too. Encourage your clinical team to name the value of time. Imagine a provider who starts the visit by saying, "I know your time is valuable, and I want to make sure we address your top concerns today." It's disarming, it's empowering, and it sets the tone for partnership. Invite feedback. Patients are often your best consultants when it comes to flow. Ask what felt slow, what confused them, what they appreciated. Then share that feedback with your team and act on it. Empower your staff, too. No one sees inefficiency more clearly than the people living it daily. Create channels where frontline suggestions are welcomed and implemented. Reward improvements with recognition and even incentives. Make time respect a performance metric. At the heart of this is leadership. Culture change starts at the top. If you're in a position of influence, model the behaviors you want to see. Show up to meetings on time. End on time. Speak openly about your respect for both staff and patient time. When issues arise, ask, how does this impact the patient's experience of time? And perhaps most radically, flip the hierarchy. Instead of asking patients to adapt to your systems, design systems that adapt to them. What if we treated our patients not as dependents, but as clients? What if we saw ourselves as the facilitators of their time, not the arbiters of it? Consider the story of one practice we worked with that completely structured their intake process. By mapping out every touch point, they realized patients were spending nearly 22 minutes in the waiting room and 12 more before seeing a provider. Through digital check-ins, triaged rooming, and staggered scheduling, they reduced the total time from door to provider to under 10 minutes. Patient satisfaction soared. So did staff morale. This isn't magic, it's medicine done thoughtfully. And the impact ripples outward. Patients who feel respected are more likely to return, refer others, follow through on care plans, and engage proactively. Practices that run smoothly experience less staff turnover, fewer complaints, and more room for joy in the work. So, as we wrap up today, I'll return to the question I opened with. What would happen if we valued our patients' time as much as they value ours? Maybe we'd see fewer empty waiting rooms, not because we're losing patients, but because we're serving them better. Maybe we'd see more gratitude in exam rooms, not because we did something extraordinary, but because we did something rare. We respected their time. If this conversation sparked ideas for your practice or left you wanting a deeper dive into operational strategies, reach out to us at Healthy Practices. We specialize in helping medical groups build systems that work for everyone, especially the patients they serve. Until next time, be well and be efficient. Thanks for tuning in to today's episode of the Medical Money Matters podcast. Before you go, let me ask you, are you ready to take your medical group's coding to the next level? Because that's where Code Mastery comes in. Code Mastery isn't just another coding program. It's the ultimate physician-to-physician training solution to maximize your revenue and empower your physicians with the skills they need to code confidently and win the coding game. From comprehensive high-octane training to actionable insights, Code Mastery gives you the edge you've been looking for. Don't leave money on the table. Visit healtheps.com/code mastery to learn more and take control of your coding today. Let's transform your practice's financial future starting now. See you next time on the Medical Money Matters podcast.